Hello everyone, I'm Dr. Afrin Rajoy and today we are going to talk about feminist family therapy. What is feminism? I think it's good to mention that there is more than one feminism. We have what they call liberal feminism, which focuses on empowering women and helping them overcome the limits and constraints of patriarchal socialization. The other type is cultural feminism, which focuses on infusing society with women's value. We have radical feminism, which focuses on social activism. We have postmodern feminism, which focuses on using deconstruction and discourse analysis to show how reality is constructed. We have women of color or womanist feminism, which focuses on racism, classism, sexism, and heterosexism are all, interlocked. And we have lesbian feminism, which focuses on heterosexism at the core of women's oppression. We have socialist feminism, which focuses on race, class, nationality, and historical biases. So I think it's good to be familiar with all these different types and, names. What is feminist theory? So feminist theory is concerned with understanding the political, economic, and social inequities between women and men. Feminism is an oppositional form of knowledge to patriarchy. It's not neutral, but let us not forget that the status quo is also not neutral. Feminists have not only addressed gender inequality, but have also exposed oppressions due to race, class, age, ethnicity, sexual preferences, and the like. One of the things that I want to highlight is feminism is not against men. Feminism is against patriarchy, and there's a big difference there. If you ask feminist family therapists who is afraid of feminism, they would probably tell you that anyone who is taking advantage of patriarchy, and I think that that is very true. Postmodernism and also feminist family therapists, they both believe in social construction and the idea of a social construction and all these different discourses that we have in our society and how those discourses would impact reality, right? However, feminist family therapists would argue that when you read all these different theories in postmodernism and postmodern theories, you see the absence of talking about gender, and because of that, someone needs to stand up and say something and say, hey, we need to consider gender in all these different theories and to talk about it and to talk about all these social injustice issues. So what is gender? This is quite interesting. So feminist family therapists and philosopher, they think that we have selected certain reproductive characteristics to mark men and women as different and keep them in their quote-unquote proper places. So gender is an invention of human societies and quite, a remarkable one. It is so interesting because we create these, gender as difference through different things. For example, we try to transform male and female infants into a stereotype masculine and feminine adults with different postures, toys, cars, clothing, expectations, all these different things, right? And then after that, we try to have a specific kind of like arrangements in society to create and maintain these arrangements that sustains the differences in men's and women's consciousness and behaviors, I don't know, such as the different demands of office and kitchen. And in this way, gendered behavior is maintained by the division of labor of men and women. Some of the terms that you hear a lot in feminism includes hierarchy, masculinity, modern masculinity, and discourses of masculinity. I'm sure you all are familiar with the definition of these terms, but an example of that is, for example, when in a society we have a specific expectation or what I call, box for a woman's voice, right? So if you have two human beings, both of them, they are expressing their thoughts, opinion, and they are assertive. If one of them was a man, then the man is assertive, right? But if one of them was a woman, then this woman is bossy. So that's a kind of like society and some of the issues that we face on a daily basis, besides all these different things that we all are aware of, right? Such as, the different salary between men and women. And it's interesting because sometimes people think that when we are talking about hierarchy or masculinity, these things, they're just going to affect women. What tends to be overlooked is that patriarchy is a system where men not only benefit from their position over women, but privileged men benefit from their position over, other men. And that is so interesting. So for example, a review of 28 school shootings in the United States from 92 to 2002 reveals that all were carried out not by poor boys but by white middle-class boys who were bullied and beaten up for such reasons as they got, for example, good grades, or were in the chess club, or were not in sports. And that is really interesting to think about. So feminist family therapists really believe that relationships are affected by gender, sexuality, culture, and all, these other stereotypes, and they really believe in connection. So kind of like it's safe to say they believe that everything is about connection that you feel with others, and the source of emotional distress in your life, it's about the disconnection with others. So in their theory and in their model, they really believe in, or they're looking for different ways to help clients feel the personal growth and foster that personal growth in their lives, and also increase their capacity to be in relationships, outside of the session. They call these two concepts growth fostering relationships. And these relationships, because that connection is really important to them and relationships are really important to them, a good relationship, they call it the 5 good things. So growth fostering relationships, including these 5 good things and features. The first one is the energy that you feel in a relationship. The second one is that sense of self-worth that you feel with the other person. The next one is the knowledge and clarity of self, other person, and the relationship. And then the fourth one is creativity and productivity that you can have in that relationship. And the last one is that the desire for more connection and and less feelings of being helpless or needy in a relationship. So hopefully all of us, we have 1 or 2 examples for these sort of relationships in our lives that when we are in that relationship, or when we were in that relationship, we really felt good about ourselves. We felt the energy, we felt the connection, we felt like there's space for us to be creative, to be connected, to be safe, and to have that kind of like clarification about who I am, about this relationship, where it's going, and all these different features. So this picture and this comic and the dialogue reminded me of the 5 good things. As you see here, it says, "Did you miss me while I was gone?" And then it says, "Yes, a lot." And then, "I also miss the bits of me that only come out when you are around. They are the best bits of me." Kind of like having that sense and that feeling in a relationship that this is a good space, a good time for me, and this relationship is safe. And when I am with you, I feel the energy, I feel the connection, I feel like I can be the best version of myself. If you watch a feminist family therapy session, one of their tapes or videos online, 2 themes that you would absolutely see in that session include egalitarian counseling relationship, which is about that fair and equal power dynamic in a session between the therapist and clients, and the other one is the conversation about source of the oppression. And again, this conversation about source of the oppression could start from the individual's life, but also, expound to the discourses that we have in a society and generally, in this universe. The process of feminist family therapy involves open discussion, mutual exploration, and self-disclosure. When we say open discussion, we mean open discussion of power dynamics that happens in the session between, the therapist and the clients, and all the conversations that they have. And also the conversations, the open discussion or conversations that a therapist could have with clients about their diagnosis, or also the communications that a therapist may have with other professionals about the client, right? So all those different aspects, even like the theory or the approach that you're using in therapy with them, all those different things, they could happen, and they, like therapists, they are open to discuss them and to have conversations about them. And one reason behind that is, what we talked in just the previous slide, right? Providing that kind of like equal power dynamic in a session in therapy, and having conversations about that. The next one is mutual exploration, and it's about how to resolve clients' issue, and when you're talking about that, how you can have this mutual exploration. So again, like back to that power dynamic, it's not that the therapist is the expert of the session and the client's life, so they are going to resolve client's issue, but rather it's like more a mutual world that therapists and clients, they go into, and they start exploring and understanding what is going on. Last one is about self-disclosure, and self-disclosure could be about, admitting the errors or the mistakes that the therapist could do in a relationship, and also just being flexible and open to, correction and receiving feedback in a session, right? So it could happen in different ways, but even like an example of that is when you're done with a session, and how sometimes after a session you think about your session, or you're in supervision, and then you realize that when you brought up XYZ conversation, then your client felt uncomfortable, but you didn't kind of like probe on that. You didn't ask anything about that, right? And then you realize that maybe it was about just me thinking that this is not the correct time. This is like we're talking about this issue right now, and it's so important, so I should not ask about how the client feels. And then next session, when you go to your session, you can start a conversation like this, that I've noticed that in our last session when we talked about blah blah blah, then I felt like you seemed like uncomfortable, and I didn't ask you any questions about that, and I was wondering if you didn't also feel comfortable to express that, or mention what you're feeling, or am I wrong, nothing happened, that kind of conversation, right? The other thing about this egalitarian and having that equal power dynamic in a session, one of the things that I talk a lot in supervision with my supervisors is that sometimes when you are, depends on all these different social location factors, right, and intersectionality, but if you are a white therapist and you are working with immigrants, right, or people of color, very, very different social location factors, or vice versa. Do you pay attention to a power dynamic in a session? I had a supervisor who was working with a couple, and the supervisor was a white man, and the couple, it included a white man as the husband, and then a person of color, an immigrant, as the wife. And when we were talking about all these different things and the dynamics and the issues, one of the questions or one of the conversations that we had was this, power dynamic in the session. Have you paid attention that you are a white man, and then your client, the husband, is white man, and then there's this woman of color in your session, right? An immigrant. So have you paid attention any sort of like alliance between you and the husband, and kind of like the wife felt like maybe she's left out, something like that, and maybe this is like similar to what she feels in a society living in the US as an immigrant, right? So just paying attention to all those different things besides the interventions or the questions that you are using in a session. Another concept which is part of the process of feminist family therapy is mutual empathy and growth. And obviously empathy is part of therapy, and it's very obvious that that's one of the things that we provide for our clients, right? But the difference here is the mutual empathy. So the empathy that you have for your clients and the clients your clients may have for you. And an example of that could be like right now I'm working with some clients with who are dealing with grief and loss, and I lost my dad last year, so I've been through this journey as well, and I am still. So an example of mutual empathy is when my clients, they tell me that it must be really hard and I'm sorry to hear about your loss, right? Or ask me a question about my journey. In some approaches, in response to that question, some of the approaches or theories which suggest that you say something such as, we are here to talk about you and not me, something like that, right? Versus in feminist family therapy, they suggest that you can say something about your journey and you can have some sort of disclosure, and you can spend 1 or 2 minutes talking about what is going on. Of course that they still have boundaries. As I usually say, the session should be your client session. It should not become your own session, your own therapy, right? So still with all those different boundaries, but it's okay to have that human being, that life experience, close to life, everyday life experience in therapy. And they believe that this can also be helpful in terms of repairing the past, the childhood traumas or wounds that we have from, these emotional connections, or, the experiences with the empathy in the past. Next thing is authenticity in the process of therapy. And feminist family therapists, they define authenticity as genuine responsiveness that keeps the well-being and needs of the client in mind. So as you try to be authentic in your session, which means that you are genuinely responsive, and you have in mind that the priority is the well-being and the needs and the welfare of the client, right? So as you try to be authentic, you can have some sort of reflection for yourself about what you're saying, what you're going to ask, what you're curious about. And those reflections could be, or those two kind of like guiding questions in that reflection could be, will this facilitate the client's growth? Will this strengthen their relationship? And is this going to help my clients outside of the therapy as well or not, right? So if that responsiveness, whether it's about like a question that clients ask you about your own grief journey or process, or something else, when you want to respond back to that, you really need to focus that, is this about me getting free therapy from clients, having this 5 minutes of session talking about myself? The session is just so complicated that I don't know what else should I ask or talk about, or what kind of intervention I should use. So I'm kind of like looking for a runaway option, and one of those runaway option could be self-disclosure, right? So it could be answering or having this conversation. If your answer is that, probably it's not going to facilitate the client's growth, and it's not going to make your relationship and the relationship stronger. So I think that, again, like reflecting on what you're doing and asking yourself, that is this going to help my clients? Is this going to help the relationship? It's those questions, and the reflection could help you with authenticity. And authenticity also involves, as we talked about it in the previous slides, it involves talking about your mistakes and apologizing for your mistakes, being accountable, and being open to feedback. So feminist family therapists, they do not agree with DSM diagnosis. They feel like, or they think that DSM diagnosis, they are very oppressive. I personally believe that DSM diagnosis, sometimes, not all the time, they are good in terms of having a shared language about what we are talking about, but thinking about them as a label and oppressive it also makes a lot of sense in a lot of contexts. The next thing that they talk about is the personal is political and the political is personal. So this is about separating internal and external source of problems through awareness of oppression, privilege, and the impact of society on individual. So the way that we are living our lives, it's really impacted by all these different discourses that we have in our society, and the oppression and the privilege and the whole power dynamic, right? And also, the way that we live our lives is going to impact this whole system. So just having that in mind as a feminist family therapist in a session, and the way that you conceptualize a case is really important. The next concept is self in relation theory, which is about the importance of relationship. So they believe that our experience of self and just the experience of that we have in life, it's around and in the context of important relationships in our life, kind of like promoting that relational perspective that we have and the importance of relationship. Next concept is about marginalization and oppression, and we already talked about it a lot. It's kind of like the main thing in feminism, but it's about oppression and isolation and considering that as root cause of clients' problems. So a feminist family therapist constantly ask questions and probing stories in different ways to understand the oppression that is going on or was going on in clients' relationship, in clients' life in regards to the problems that they are talking about. Next concept is relational images, which is about the fact that all the experiences that we have in life, in our early life as a child, as a teenager, and especially about the important relationships that we had and important figures that we have, like the relationship that we had with our main caregivers, right? Such as parents or sometimes extended family members. Those relationships, they are really important and they are going to impact and affect present relationships that we have in our lives. Next concept is relational resilience, and it's kind of like the idea that you read about and you study about in other theories as well, that because of the fact that you are not going to find a perfect person in this world, right? Someone who is going to meet all the needs you have, or the same for you, like you're not going to meet all the needs for someone else. Because of that, you need to have or promote this relational resilience in your relationship, kind of like willing to after any sort of disconnection or mistakes or failure in a relationship, willing to work on it, ask for help, and kind of be resilient towards it. Next concept is the courage, or what Brené Brown calls vulnerability. So that characteristics or that concepts that you feel like you can be courage and vulnerable in a relationship, so you can open up and talk about all these different things, and that is one of the requirements of for a happy relationship, or one of those 5 good things that we talked about earlier. Next one is mattering and connection, which is about relationships and the fact that all of us, we want to feel that we matter, we are important, we are a priority, and we feel that connection in our relationships and in our lives, right? And a lot of research studies show that that is so important, and that is linked to our mental and also physical health in our lives. Next one is disconnection strategies, or central relational paradox. So it's about the fact that when you are a feminist family therapist, you want to be very curious about different ways that clients they try to disconnect from other people, kind of like pushing and pulling dynamic, and then the different ways that they do that. Is it aggressive? Is it assertive? Like what kind of patterns they use, and kind of like considering that in clients' lives, relationships, and issues as well. As a feminist family therapist, you want to help your clients to build growth fostering relationships. So that connection piece is really important, and it's one of the goals of therapy, and one of the things that would target change in that theory or approach. The other goal is sociopolitical awareness and empowerment. So feminist family therapists want to help clients to be aware of their own social class, all the different social location factors, right? Sexual orientation, social class, gender, abilities, all these different things. And they believe that this awareness would contribute to their experience of self, identity, and the relationships that they have in life. So what kind of interventions do feminist family therapists use? The first one is any intervention if it is adapted to a gender and culturally sensitive manner. It seems easy, and at the same time, it is not easy all the time. So you really need to be, I think, careful and mindful and seek trainings about that. The next one is gender role analysis. So obviously, based on all these conversations that we had today, in the sessions, feminist family therapists, they try to ask questions which help clients to have or encourage clients to examine how cultural rules about male and female behavior affects their current story, right? So for example, when I see a woman who is a mom and tells me that I'm dealing with depression, all these different stories, one of the questions that I can ask is, what do you think about the messages or the norms that we have in our society about being a mom and a woman and peacemaker and, taking care of everything? How does that contribute to what you are feeling right now, to the depression from your perspective, right? Kind of like bringing larger discourses to the conversation, to therapy, and thinking about the impact of the norms and the gender norms and stereotypes of society in the current or on the current issue or problem. Next things include the intervention includes assertiveness training, self-esteem training, and you can do that in many different ways. But one of them is just simply similar to CBT or psychoeducational sessions, talking about the difference between assertiveness, being passive, and being aggressive. So all those different things. The same thing about self-esteem, about self-compassion, about seeing the self and respecting the self. Next one is self-empathy, kind of like having that empathy and attention which is focused on yourself instead of just others. And again, like maybe even like linking that to the discourses that we have in our society about gender norms and gender roles. And the last one is social activism, which is encouraging clients to be active in social activism and the different activities in that sense. I think it's very obvious that feminist family therapy is very aligned with the trainings and the cultural humility in diversity and culture, and respecting and honoring and celebrating diversity and culture. The only thing is, as the same as other approaches, we really need to be careful to not push clients or force our ideas on them in this model. Now that you learned about feminist family therapy, think about yourself with whatever social location factors you have and the intersectionality of those factors in different communities. And then think about feminist family therapy. How would you feel if you went to a therapist with this approach? How would you feel if you experience some of the interventions, techniques, conversations, and different things that we just talked about in this lecture in your therapy based on feminist family therapy? Think about your responses, your reaction, your feelings. Why do you have those reactions, feelings? Where do they come from? And how are they going to affect your work as a therapist in the future? Leslie Shore has this book called Tending Inner Gardens, The Healing Art of Feminist Psychotherapy, and I'm going to finish this lecture by a quote by Leslie. She says, "Although therapists are often nicknamed shrinks, I prefer to think of the work we do as having an expansive effect on clients. We enable clients to open inner doors, widen horizons, unfurl leaves, and develop inner potentials." So, think about feminist family therapy and this quote, and reflect on the different ways that you may be able to have expansive effects on clients with all these different concepts, intervention, and techniques in feminist family therapy. Thank you.